Doctor, what were the other types of trauma you mentioned? Well, one was arthropathy. And what is arthropathy? Well, arthropathy may develop following decompression, radiation, frostbite, or the like. And is there a medico-legal problem there? What do you mean? It may arise when there is an aggravation of pre-existing arthritis. Yes, and the causal relationship between the traumatic episode and joint affections is veiled. What is arthropathy, doctor? It is any disease of the joints. Is bursitis arthropathy? Bursitis is an inflammation of a bursa. And what is chondritis? Chondritis is the inflammation of a cartilage. And what is chondroblastoma? Chondroblastoma is a benign, vascular, cartilaginous tumor arising from the epiphysis of a long bone. And chondrocalcinosis? Chondrocalcinosis is a pseudo-gout. And what is a pseudo-gout? It is an acute, recurrent joint disease affecting the cartilaginous structures of large joints, especially the knee. Is synovial fluid involved, doctor? Yes, synovial fluid contains calcium and pyrophosphates. Doctor, what is a chondroma? A chondroma is a benign neoplasm arising from cartilage. And a chondrosarcoma? A chondrosarcoma is a malignant tumor derived from cartilage. What is a Cox arthrosis? A Cox arthrosis is a hip joint, trophic degeneration of the hip joint. And destructive coxopathy? Destructive coxopathy is the painful disability of the hip joint associated with nocturnal distress of an inflammatory type. The joint motion is moderately impaired. Is there a dislocation, doctor? Yes, a displacement of a bone from the natural position in a joint. What is fibrositis? Fibrositis, or muscular rheumatism, is a periarthritis, a periarticular fibrositis. It is a rheumatoid condition affecting the muscles and tissues around the joints. Doctor, what is a hallux malleus? It is a hammer toe. What is a hallux valgus? A hallux valgus is the deflection of the great toe to the other side of the foot and subsequent development of bony prominences. Finally, doctor, the hallux varus. The hallux varus is a deflection of the great toe toward the inner side of the foot. And hemarthrosis is mentioned in your hospital report. Yes, I found a bloody effusion in a joint cavity. It is prone to occur to hemophiliacs. Was there a herniated intervertebral disc? Yes, a herniated nucleus pulposus, a tear of the annulus fibrosus followed by protrusion of the nucleus pulposus, compression of the nerve root, back pain with or without sciatic radiation, and paresthesias, that is, pricking or numbness of the calf or foot. The rupture usually occurs to the lumbar, sacral, and cervical regions of the spine. Doctor, the internal derangement of the knee joint is a term which refers to what? It is a term which refers to various joint lesions which interfere with motion, such as locking, snapping, buckling, due to atrophy of the thigh muscles, tenderness or pain, and joint swelling. Some leading causes are tears of the menisci, ligaments, patella or quadriceps tendons, loose bodies, fracture or chondromalacia of the patella. And what is kyphosis, doctor? Kyphosis is a hunchback, an abnormal posterior curvature of the thoracic spine. And lordosis? Lordosis is a hollow back, anterior convexity of the lower spine. What is a painful shoulder? Non-articular, doctor. It is a disorder characterized by tenderness, moderate to agonizing pain, and limitation of motion. These symptomatologies are present in adhesive capsulitis, adhesive bursitis, frozen shoulder, adhesions within the bursa causing stiffness, and later atrophic changes. Is there a hand-shoulder syndrome? Yes, it is peculiar, a peculiar entity, a clinical entity in which pain radiates from the shoulder to the fingertips. The patient spontaneously immobilizes the affected extremity, which leads to atrophy and edema of the hand. Later, overactivity of sympathetic nerves results in a sweaty, cold, painful hand, followed by stiffness and fibrosis of the joints. The syndrome may occur following a myocardial infarction. Doctor, what is the supraspinatus syndrome? The supraspinatus syndrome is a disorder caused by adhesions, calcium deposits, or tears in the rotator cuff, resulting in a painful shoulder, limited motion, muscle atrophy, and spasm. What is a scoliosis? A scoliosis is a lateral spinal curvature. I keep you on your toes?
Yeah.
You should be able to read that. It was last taken on July 19th, 1990.
1990, by whom was that?
So that would be probably by a class in the Southern District of Reporters. East Communication.